All right. Hello, everyone. Well, welcome to our first MPH alumni free webinar series, session number 1, Getting Started in Public Health Research. We're so excited to have you today. A couple of our speakers. My name is Dr. Alexandra Oslander. I teach I'm a full-time faculty in the public health program. I'm sure I had all of you in PH 566, which was our capstone and is now our integrated learning experience. I'm so excited about that. That's a little bit see if that might be in the webinar in the future, talking about our changes. Our first speaker today is Dr. Rayanne Leal. She's one of our faculty in our department, focusing a lot on environmental health, right, Rayanne?
Well, thank you, Dr. Oslander, for starting us with a great introduction. So our theme, getting started in public health research, we must discuss online surveys. So if we can go to the next slide, that would be great.
Sure.
So online surveys are questionnaires conducted over the internet where participants respond to a series of questions via a web-based platform. This method has become increasingly popular due to its efficiency and reach. These surveys are widely used in research and business due to their convenience, cost effectiveness, and ability to reach a larger audience at a quicker pace. They can vary in complexity, ranging from simple questionnaire forms to sophisticated surveys with multimedia elements. Online surveys can be distributed through email, social media, or embedded on websites, and typically include a range of questions such as multiple choice, Likert scales, and open-ended responses. And we'll go into more detail about those types of questions later on in the webinar. So the data collected from online surveys is generally analyzed using statistical software to generate insights and inform decision-making. And a few of my colleagues will go into more detail regarding the type of methods and tools that are available for us on that. So in 2024, survey research has been shaped by a rapid technological advancement and evolving ethical standards. Online and mobile survey platforms can be powered by AI and machine learning. This streamlines the design and analysis. And in addition to that, we have to pay attention to regulatory compliance with data privacy laws like the General Data Protection Regulation and the California Consumer Privacy Act. These are crucial to understand when dealing with online survey data. Adaptive surveys and mixed methods are enhancing data quality and respondent engagement. There are some challenges which include maintaining high quality data and ensuring participant privacy. But ongoing innovations aim to address these issues, making survey research more efficient and effective. So let's go to the next slide. Oh, perfect. Okay. So quantitative versus qualitative research. Yeah, that side, perfect. Survey research. So I'll briefly talk about the differences between quantitative and qualitative survey research. So quantitative survey research focuses on analyzing numerical data from structured surveys. It uses statistical methods to find patterns and relationships. The aim is to quantify data and generalize results to larger populations. For instance, you might use descriptive statistics to summarize data or inferential statistics to test hypotheses. My colleague, Dr. Gill, will discuss later in this presentation the tools used to run these statistical tests. So for qualitative survey research, on the other hand, it examines non-numeric data, such as open-ended responses. This is to gain insight into respondents' experiences and attitudes. So techniques like thematic and content analysis help identify key themes and patterns. Dr. Cohen will also discuss tools used to organize and analyze qualitative data further along in our presentation. Okay, so quantitative and qualitative are very effective in their goals and what they do, and we also have a combination of both, so you can use like a mixed method combining both of those. So Now we're on to free software. So now we'll discuss an overview of free software options for online surveys. Here are some popular tools that you can use. The first one is Google Forms. This one is ideal for those seeking ease of use, seamless integration with other Google services. It's perfect for quick surveys and data collection. The second one, which you probably heard mostly, is SurveyMonkey. It's a well-known tool with a basic free plan that offers essential survey features. It's a great choice for those who need a reliable and widely used platform. And thirdly, we have Microsoft Forms. This one's best suited for Office 365 users. This tool integrates smoothly with other Microsoft services, providing a familiar environment for survey creation. Then we also have Typeform, known for its interactive and user-friendly interface. Typeform is a free plan that's limited to but engaging as well. And then finally, we have Lime Survey, an open source option that is highly customizable, making it ideal for those who need a more tailored survey solution. Well, each of these tools has its strengths, so choose the best one that fits your survey needs and preferences. And we'll go to the next slide, which is types of questions. So let's examine the different types of questions commonly used in public health surveys and their applications. So the first one is multiple choice. This format allows respondents to select one option from a list. For example, in a survey assessing dietary habits, you might ask, what is your primary source of dietary protein? With options like meat, dairy, legumes, and nuts. The second type of question would be the all that apply. So respondents can choose all relevant options. For instance, to understand health behaviors, you could ask, which of the following preventive measures do you use regularly? With choices such as vaccination, hand washing, exercise, and healthy eating. Then, as we mentioned earlier, the Likert scale. This scale measures attitudes or opinions on a range, typically 1 to 5. For example, to gauge satisfaction with public health services, you might ask, how satisfied are you with availability of healthcare facilities? Ranging from 1 very unsatisfied to 5 very satisfied. And then finally, we have our open-ended questions. This allows respondents to provide detailed answers in their own words. So for example, what improvements would you like to see in community programs? Each question type is designed to gather specific types of data and help us better understand and address public health needs. So the next slide will be our best practices. So when designing public health surveys, adhering to best practices ensures that your questions are effective and reliable. So we'll talk about a few considerations when you are doing survey research here. The first one is clarity and simplicity. Make sure each question is straightforward and easy to understand. This helps respondents provide accurate and relevant answers. The second point is relevance. So you want to ensure that every question aligns with survey objectives. This keeps the survey focused and meaningful. And this one's a really important one, avoiding bias. Frame your questions neutrally to prevent influencing respondents' answers. This ensures that the collected data is unbiased and representative, which we want to do that in our research. Our fourth key point is inclusivity. So use language that is accessible and inclusive to all demographic groups, avoiding jargon and ensuring all participants can engage fully. And finally, we have pilot testing. So it's important to conduct a pilot test with a small group before launching the survey widely. This helps identify and resolve any issues improving your overall quality of the survey. By applying these best practices, you can design public health surveys that yield comprehensive and actionable data. We love the actionable data, and that's really important for us in public health. So the next slide is effective quantitative questions. In public health research, the quality of your survey questions can significantly impact the reliability of your data. So a good quantitative question is clear and specific. And an example would be, how many servings of fruit and vegetables do you eat per day? Why is this effective? This question is clear, specific, and provides predefined response options that are easy to analyze. Then you have the time bound. An example would be, in the past month, how many times have you engaged in physical exercise for at least 30 minutes? And why is this effective? By specifying a time frame, this question helps respondents recall their behavior more accurately and provides useful data for analysis. And finally, a effective behavior focused question would be, how often do you wash your hands after using the restroom? Always, often, sometimes, rarely, or never. Why is this one effective? This question focuses on a specific behavior and uses a Likert scale to measure frequency, which is useful for public health research. So by using well-crafted questions like these, you ensure that your survey yields clear, actionable data, again, which is what we want to do. So our next slide is talking about ineffective quantitative questions. So it's crucial to avoid questions that can lead to unclear or unreliable data. So a bad quantitative question would be vague and ambiguous. For example, do you eat healthy? Why is this ineffective? This question is subjective and lacks clarity on what constitutes healthy eating. It does not provide actionable data. Then another question that is not effective is double-barreled. For example, do you exercise regularly and eat a balanced diet? Why is this one ineffective? This question asks about two behaviors, making it unclear which behavior the respondent is answering about, leading to unreliable data. And finally, another ineffective question for quantitative data would be open-ended. How do you feel about your overall health? Why is this one ineffective? While this may be useful for qualitative data, it is not a good quantitative question as it is difficult to quantify and analyze statistically. So avoiding these pitfalls will help ensure survey questions are clear, focused, and yield actionable data. And then we're going to move on to qualitative questions. So effective qualitative questions, it's essential to ask questions that elicit detailed and insightful responses. An example of an effective qualitative question encourages detailed responses. For example, can you describe a time when you faced challenges accessing healthcare services? So why is this one effective? This question invites respondents to share detailed personal experiences, providing rich qualitative data. Open-ended questions with a clear focus. So an example would be, what are your thoughts on the current public health initiatives in your community? Why is this effective? This question is open-ended but directed, allowing respondents to provide detailed feedback on a specific topic. Then we have exploratory and insightful questions. An example of this type would be, how has your lifestyle changed since the implementation of the new public health policies? This one is effective because the question seeks to understand the impact of specific policies, encouraging respondents to reflect on their personal experiences. Using well-crafted qualitative questions helps gather deep insights into public health issues and informs better decision-making. And in public health, it's great to be able to impact decision-making and policy. So let's move to the next slide, which is going to talk about ineffective qualitative questions. So in qualitative research, it's crucial to avoid questions that can lead to vague, biased, or overly simplistic responses. So here are some examples of some ineffective qualitative questions. They're usually too vague. So, for example, what do you think about public health? This one is ineffective because it's too broad and does not guide respondents towards specific aspects of public health, leading to unfocused answers. Then you also have the questions that lend itself to yes and no answers. Do you like the new public health program? This question is ineffective because it's too simple and does not encourage detailed responses, limiting the depth of the information gathered. And finally, leading or biased questions. For example, do you think the new health policies are effective? Why is this ineffective? This question suggests a particular answer, which can bias the respondent's reply and reduce the validity of the data. So, avoiding these pitfalls will help ensure your qualitative data is rich, detailed, and unbiased. Now we're going to transition into the portion of the presentation that discusses how analyzing quantitative and qualitative survey data and the tools used to accomplish this task. I'd like to pass the conversation to Dr. Auslander as she begins our discussion on analysis and tools. Thank you.
Thank you, Dr. Leal. That was wonderful. Really appreciate that. Moving forward, if you haven't already, if you could fill out the survey, we're going to be using that in just a few moments, showing how to do some basic, use some of the basic tools and knowledge that Dr. Leal just discussed, and how to do some a little bit of analysis using something as simple as Microsoft Forms, right? And how to do things like cross-tabulation. So what is cross-tabulation? It's a 2 or more dimensional table that records a number or frequency of respondents that had specific characteristics described in the SAIL. So like you can calculate percentages. For example, you want to look at gender versus career status, or if you want to look at something of graduation date and how quickly to get a position. Things like that, we can look at with a really quick, simple quantitative analysis using Microsoft Forms and then into Excel. So I'm going to minimize this. All right. And I'm going to stop share really quickly. And we're going to go back and we're going to jump into the Microsoft or into the table. Can everyone see the questionnaire? Good. Sorry, I couldn't see. Can everybody see it? Yeah, perfect. All right.
Yes.
Yeah. Thank you. So this is the questionnaire that everyone or a few of you filled out. And it asks some basic questions. Do you have research experience, right? These are binary questions or 2 questions, right? A yes or no. Are you currently working in the public health sector? And then we're looking more at kind of like types of tables where what interests you. Are you interested in epidemiology, community health, environmental health, global health, public health policy? And at what level are you interested in? Some open-ended questions. What are you hoping to achieve through this webinar? And some more demographic questions. You know, what is your gender? What year did you graduate? And how old are you? And then another open-ended question, kind of for future information, what topic would you like to see on the next webinar? So these forms are really easy to put together and to distribute. And then if you do put them together, you can go to the responses and you can see a snapshot of what the results were. All right. And you can take this information and where it says open results in Excel, you can click on here and we'll open to an Excel file for you. And you will get all the information in the table form, right? And if we want to go up, you can search for cross pivot table. Go to the pivot table where you insert a pivot table. And if you want to, you can put a new sheet. Actually, I'm sorry, you know what? Let's go back. Let's do an existing sheet so we can see both into the existing sheet. And we can insert a pivot table like this. Insert. And we want to ask questions like, what do we want to see? All right. So in the rows, we might want to see, all right, age, right? And the age goes in there. And then for columns, we may want to see, are you currently working in the public health field? All right, so add to rows. I'm sorry, I didn't mean that. I meant to add to columns. Let's do that again. You can add to columns, and then you can see, are you currently working in this field and based upon age? And if you've not previously worked here, and you can get basic information, or if you want to see, perhaps instead of, are you currently working, maybe we want to look at what areas of public health you're interested in, right? And maybe you want to add this to the column section. And then we can see what areas are you interested in versus how old you are. Or perhaps we would like to see what year did you graduate? And maybe we want to see from a demographic perspective, gender, right? So we can add gender to the columns. And we can look at what are the different areas based upon the information up here, right? And so we can create easy pivot tables just to look at quick cross tabulations to see basic associations, looking at gender, looking at age, looking at interest levels, and this is something that you can easily do without a lot of experience in quantitative and qualitative data. Right. So I want to go back to the slides. Here we are. And I'm going to pass it on to Dr. Goggandeep Gill, and who has, I'm sure you've had in Public Health 521 or Public Health 540, and he is going to talk about quantitative software and the public health industry.
Yeah, thank you, Dr. Oslander. You guys may have had my course 521 or 440 with biostatistics. There's a lot of software out there. As you guys see, there's SAS, Python, R, Strata, SPSS, Tableau, Excel, as Dr. Oslander just pointed out. Different price points. So it's really kind of what you make it, right? What I mean by that is you can make, if you are really interested, really want to get into this, investing more money to a statistical program, could be a value or could be, something you want to pursue. But one caveat is some of these, there's a lot of software out there, but some of these are not, industry focused, such as R or Python. They are free. They're great to learn. But in government and industry sectors, they're open source, meaning there's no validated, there's just all this information coming in, and you could use packages and you get information easily, but that's not always recommended because of privacy and just the data standards that industries and government have. But as you probably know, we use Excel. I know some ones that are very good that I currently use are SPSS and Tableau. Those are good price points that really can do a lot as far as visualization, a little bit more than Excel. The data is much more robust, and but you can do more statistical analysis in a certain way. Those are the ones I currently use. Strata is a good one as well. This one's a little bit more code-based, where you type in, so is SAS, but where you can actually type in codes and commands, and they, can produce results that way. Those invest a little bit more time, a couple boot camps, maybe a couple, tutorials. Each of the websites offer tutorials as well, so you can get further information if interested. And if you have any other questions with that, please let me know. I'd be happy to assist you in learning or telling you what, informing you what to give advice of what good packages you can use.
Awesome. Thank you so much. Now we're going to move on to Dr. Greg Cohen, and he's going to discuss qualitative research tools.
Thank you, Dr. Oslander. Hi, everybody. Some of you may have had me in epidemiology as well as professional writing in public health and program planning, where sometimes we uncover some things about qualitative data, or we talk about things, the best ways to get qualitative data, which tend to be typically through open-ended questionnaires and surveys, as Dr. Leal had pointed out earlier, key informant interviews, and then what most people think about when they think about qualitative research, which is focus groups. And there's quite a number of ways to do focus groups as we head more into the digital world. And, you know, as a byproduct, especially of COVID, a lot of focus groups have went online through things such as Zoom, like we're on right now. And then from there, it's trying to figure out how to get all that data into a place where you can analyze it. Qualitative data is often has to be transcribed. So if you don't have a second person with you, because if you're the facilitator, trying to transcribe and take notes could be disadvantageous to you because you may lose certain things about how groups interact while you're doing focus groups. So it's good to have someone with you. If not, for example, if you're doing Zoom, for example, or even an audio recording, there are ways in which you can get these transcribed into there are services that can transcribe this for you. One is rev.com, which you see on the screen here, which can do both human transcription and AI transcription. The cost is different, obviously, having someone sit there and go through the entire video and type out what everyone says. The good thing is you do get a report afterwards that has the entire, let's say you did a focus group for 1 hour, you have the entire, everything transcribed for that entire hour. And then you can change people's names to de-identify them so that you can do your analysis unbiased. There's also transcribing software such as In Vivo that you see at the bottom right of the screen as well there. And then there's a few helpful websites. This one by Chattermill, which describes the difference between inductive and deductive coding. Think of inductive coding as something where you're starting with what you're trying to figure out, your hypothesis, and you're working your way to the themes. Whereas it's kind of the first step if you've never done this as part of your research. But if you already have themes created and you're trying to just confirm those themes, then deductive coding would be more advantageous, or what you would use basically. So inductive, you're starting with a theory and you're working down to the nitty-gritty versus the other way around, because you have to create tags for some of the respondents' comments. This way you can then put things into themes, because thematic coding is the way in which most focus groups, most key informant interviews and qualitative research is done. And this has been shown by Braun and Clark, which we have a few references on the next slide. We'll call them, I like to refer to them as the quote unquote God people of thematic analysis and reflective thematic analysis. How we create themes. This way we can put our analysis in more concrete and cohesive ways. We see a lot of qualitative research done in consumer marketing, but public health uses it as well to understand people's opinions and perceptions. For example, during COVID, there was focus groups and things like that done to understand how people perceive, wearing masks and the guidelines that were created to keep people safe. So qualitative analysis can do a lot, especially if you are steering away from quantitative. But as Dr. Leal talked about at the beginning of the presentation, is things that make your research really strong is what we call mixed methods approaches, which combine both quantitative and qualitative data.
Great, thank you so much. Last but not least, we're going to talk about our West Coast University Journal of Health and Wellness, and Dean Mutapa is going to jump on and talk a little bit more about it.
Yes, thank you, Alex. Thank you, Gagadi. Thank you, Greg, for a great conversation about qualitative analysis, quantitative analysis. We can ask some questions after I just go over a few minutes about the journal. There's a QR code to get to the journal website. But actually, if you just type in WCU Journal of Health and Wellness, it actually shows up. So it's really exciting. So in my previous position, I was the editor of a journal that was owned by the university. So when I came here in July 2022, I told the provost, hey, I want to do something like this with the journal here. And so we got a journal committee going, and they came upon this title, the WCU Journal of Health and Wellness, and we've gotten a lot of submissions. We're looking to get our first issue up probably August, September, because we're probably going to have 5 articles. Our goal is to do at least 5 articles a year, 5 articles an issue, 2 issues a year, so maybe 10 articles a year, and we're going to hit that mark, it seems, in September. The exciting thing about us is a lot of journals, you do have a submission fee and or a publication fee and or for people to access, general public, for readers to access your article, they might have to pay $40, something like that. So we are completely open access, no cost to the contributor. And our editorial board and me, we work closely with some people, some colleagues who are maybe relatively new to publishing. And if we see major issues, I kind of help, we kind of help to get to the point that they could be publishable. We can never guarantee publication, but we provide a lot of support, more than the average journal would. So that's an exciting development. One of our own students has already published. It's going to be published soon. One of our own MPH students. So it's there for you. So if you have any questions and you like to get involved in research yourself, Rukiye, I got you in touch with Dr. Leal, because I know that you wanted to get to do some research. So I got you two in touch with each other via email. But if anybody else is interested, this is an opportunity for you. Fariha, you're doing research with Dr. Tardif, so this is a possibility for you as well. So thank you so much.
Great. Yes, please check it out. It's really an exciting thing that we have here, and really great opportunity
And
that a lot of other
Alex,
universities don't.
You're on the editorial board as well. Yes.
Yes, I'm looking forward to hopefully getting your manuscripts. Now, last thing, we want to know about you and what you're up to. So if you haven't already done the alumni survey, if you could please scan this and complete it. There is a small incentive included. It's going to really help us with CEEF accreditation and going through it. We really want to know about you, what you're doing, and what you want to see more of for something like this. All right. So last thing is going to be questions and answers. And I'm just going to stop sharing right now, and I'll stop recording. And thank you guys so much for those at home that aren't here on the actual live webinar, but please watch it. If you do have any questions, feel free to email us or reach out to us, and we'll be in touch with our next interview or next.
Well, yeah. Let's take a little breather, and does anybody in the audience have any questions? Because I know I have a couple of them.
Did you want to record the questions?
I guess
usually not.
Yeah.
Okay, you want to? Okay, perfect.
Yeah. So Dr. Oslander, one question I have for you, because we went over crosstabs pretty quickly in Excel.
Yeah.
So crosstabs is pretty useful when we want to compare people, or let's say I give an answer. What are you interested in for your future career? And let's say I want to compare that by age group differences. Like, okay, people who are 40 and under are interested in this, and people who are over 40 are interested in that. That's an example of a crosstab. You went over it very nicely, how to do it, and you can calculate percentages from those numbers. If I didn't remember exactly how you did it in today's webinar, how should I Google search that?
With Excel, it's pivot tables. So you could Google pivot table and for Excel. You can always just Google cross tabulations, depending obviously, like all the survey different what's it called, software that Dr. Gill presented. They have different ways to go about it. It's quite easy in SPSS. I think you can just basically Google how to do cross tabulations in SPSS, or but if you were doing it in Excel, you could do pivot tables, and there are a lot of different explanation for it. But you can always email us. We'd be happy to walk it through with you how to do it anytime.
Awesome. And Dr. Cohen, I had a question for you. Can you give an example of a kind of study where you'd say, I should do some qualitative research, get some transcripts, and do analyses that way thematically? Can you see what kind of example would you be able to, so that we can kind of visualize? Yeah,
I mean, a lot of it just depends on the research question, to be honest with you. If you're trying to understand, as I mentioned, COVID, for example, if you're trying to do a study on if you're trying to study younger people and how COVID impacted mental health and academics, for example, with people having to learn on Zoom, especially in the public school system and things along those lines. You can do focus groups on their opinions and perceptions of how learning went, as well as, connections, community, things along those lines, so that you can understand mental health components as well, from their own perception. And then if you wanted to combine that with quantitative data, you can do surveys and get information on depression scales and things along those, and anxiety scales, and see based on the overall feel of people if they are more anxious now, less anxious, things along those lines.
Wonderful, thank you. Great example.
Are there any other questions, comments?
Okay, I think we're good.
All right, well, thank you guys. I'm gonna stop recording.